Good morning, everyone. Thank you for joining us and welcome back. We are glad that you're here. I'm Steve.
And I'm Scott.
And together we're Backyard Musings, the science and technology channel.
Yeah, and today we're talking about, I'm sure you guys have heard about this cruise ship that was affected by a hantavirus outbreak. And we talked about the hantavirus here within the last couple of weeks, I think, right? We talked about a couple of other cases or something, but this is kind of a scary thing because, this comes from the rodent.
Yeah, it's like the Black Plague.
Yeah, and it's killing people and making people sick. So
it killed Gene Hackman's wife, right? We were talking about that off camera.
Yep.
Yeah,
and then
I just did some quick research, and I was telling Scott that there were 890 cases of the hantavirus in the United States in 2023.
Yeah, so not a pandemic or anything or an epidemic, but still, that's a lot of people to die from rodent poop.
Yeah.
So, contact of rodent poop. So.
Okay, so this segment is in like a question and answer type thing. So Scott and I will be going back and forth. All right, here we go. A rare and deadly hantavirus outbreak linked to the expedition cruise ship MV Hondius has set off an international public health investigation after at least 3 passengers died and others became ill during a South Atlantic voyage. Officials in several countries are now tracking and monitoring passengers because the outbreak involves Andes virus, an uncommon hantavirus strain that, unlike most others, can sometimes spread between people during close contact. Normally, it's the rodent's feces. Right. Would you like to know more?
Okay, to explain what is known and what remains uncertain, Scott Pagan, a professor of biomedical sciences at the UC Riverside School of Medicine,
just down the hill.
Yep, just down the hill, addresses key questions about hantavirus in the Q&A session. Pagan studies emerging infectious diseases, how viruses interact with the immune system, and the development of vaccines and antiviral treatments, with a particular focus on coronaviruses and Crimean Congo
hemorrhagic.
What is that? Hemorrhagic fever virus. No idea what that is.
Don't even want to know. It bleeds from your pores.
Okay. He is also a lieutenant colonel in the United States Army Reserve, an Operation Iraqi Freedom combat veteran, and the author of numerous scientific papers on infectious diseases therapies and immunology.
What is hantavirus and how does it spread, Scott?
Okay, hantavirus is a catch-all term used to describe a family of viruses that can cause either hemorrhagic fever with renal syndrome or HFRS or hantavirus pulmonary syndrome, HPS. These viruses are found worldwide, with those in the Americas causing HPS in humans, while those in Africa, Asia, and Europe generally cause HFRS.
In the U.S., the primary strain responsible for most disease cases is the sin nombre virus found in the western U.S., United States, along with other strains such as the New York virus in the eastern U.S. In South America, the Andes virus is a notable hantavirus strain. The case fatality rate for hantavirus pulmonary syndrome, HPS, is approximately 40% among those who develop severe disease. Wow. The reservoir for these viruses is small rodents.
Typically, hantavirus outbreaks are small and human-to-human transmission does not readily occur. Most cases result from exposure to infected rodents. This can occur through physical contact with infected rodents, example of bites or scratches, ingestion of food contaminated by rodents, or exposure to virus containing urine, feces, saliva, blood, or other bodily fluids that become aerosolized when cleaning rodent-infected areas.
Yeah, so we found some mouse droppings in the garage a couple years ago, and I set out a trap, and this little monster, this mouse, he was well fed. His tail was as long as his body, about that big. And we had to clean that up, and we were very careful about cleaning up all the poo. We were very careful. Crazy.
Yeah.
The recent outbreak involving Andes virus has drawn attention because this hantavirus appears to be transmitted more readily from human to human than other hantaviruses. However, the mode of transmission in these cases remains similar to that of other hantaviruses. This type of transmission occurs through exchanges of bodily fluids associated with close contact, much like its Bunya virus relative, Crimean Congo hemorrhagic fever virus, which is a focus of his research, Dr. Pagan. In this form of transition, the virus can spread via respiratory droplets, but this is generally considered distinct from true airborne transmission.
Okay, another question here. What makes hantavirus particularly concerning in confined environments like cruise ships, and how does transmission risk differ from one common respiratory from more common respiratory viruses?
Well, this is a good cause of panic, man. Rats on a ship. This is like in the medieval times, right?
Well, yeah, but you think about the air circulation on that ship, right? Because a lot of the cabins and stuff are below the deck.
Yeah.
So they have a lot of fresh air. So they're piping that stuff, right? They're circulating it.
Yeah.
And so everybody's sharing everything. It's like being on a plane, just
But the food's better on the boat.
What's free, and you get food.
Free and it's better.
You don't even get food on an airplane anymore, do you? A bag of
peanuts. Peanuts and crackers. Okay, as with Andes virus and other hantaviruses, close proximity plays a key role in human-to-human transmission. A confined space such as a cruise ship cabin, especially among family members, can present a higher risk of transmission from an infected individual.
Unlike measles and SARS-CoV-2, which are highly contagious and considered airborne, Andes virus is not in the same category of transmissibility. At the height of the COVID-19 pandemic, one infected person could, on average, infect 15 to 20 others.
Mm-hmm.
In contrast, those affected with Andes virus typically infect fewer than one other person on average. In this case, the confined environment of the cruise ship likely played an important role in facilitating transmission.
Yeah. Many people associate hantavirus with rural rodent exposure. Scott, are these misconceptions the public should understand about how outbreaks can occur in travel or hospitality settings?
Well, let's hear what they say here. In the U.S., most outbreaks have occurred in rural environments because that is where rodent-human contact most commonly occurs. Farms, ranches, and other agricultural areas generally have resident rodent populations that can serve as reservoirs for these viruses. Successful public health and sanitation efforts in the U.S. have limited rodent-human interactions in many other settings.
I wonder what happens to the cat who's chasing down the rodent and kills it or eats it, or plays with it.
I don't know. Maybe they're immune to it.
Maybe. However, this can create a false sense of security that people in non-rural areas are not at risk. The key factor with hantavirus, whether Andes virus or sin nombre virus, is rodent-human contact.
Yeah, public health and sanitation efforts in some countries outside the U.S. and other developed nations can be significantly less robust or less effective, which may increase risk in certain environments.
Okay. Scott, what symptoms should travelers and clinicians watch for after a potential hantavirus exposure, and how quickly can the illness become serious?
Okay, here we go. Early symptoms of hantavirus infection are generally flu-like, including fatigue, muscle aches, and fever. Dizziness and gastrointestinal symptoms such as abdominal pain, nausea, and diarrhea may also occur. These initial symptoms typically begin 1 to 8 weeks after exposure.
Yeah, I think, Scott, we were talking about how I was in Afghanistan, about ready to go on R&R leave to Hawaii, or was it California? I think it was California. Hawaii was Iraq. And I ate at that bazaar, that Afghani bazaar, and they had the meat sitting out with a handkerchief over it, and all the flies were on it, right? And I got all these symptoms: nausea, diarrhea, abdominal pain, gastro, headache, dizziness. But it went away in like 3 days, 2 or 3 days.
Why would you eat meat that's covered by a napkin and then covered by flies? Don't answer that question.
I don't know, man. My buddy is the one who talked me into going there, and he said the food's good. And I saw the flies. I'm like, oh man, but I wasn't like, okay, so it gets cooked out. So, you know,
You mean they didn't have a rating sign outside their window?
there was no window, man. It was like a tent.
No.
It's Afghanistan.
Open
man.
air.
Yeah, open air is what it
That's
was.
trouble.
At least they had tables and chairs we could sit down at, but no cutlery. The Afghanis were just using their clean hand,
Right.
their clean hand to eat. You know, they just dip into the rice and put it in their mouth.
All right, let's get through this segment.
All right, 4 to 10 days after symptom onset, hantavirus pulmonary syndrome can become more severe and clinically apparent with coughing and shortness of breath, rapidly progressing to respiratory failure. Blood tests can be used to diagnose infection, but they're typically most reliable when performed more than 72 hours after symptom onset. Well, they said 1 to 8 weeks, so 72 hours, yeah. Go in on day 4, get checked out.
For travelers and clinicians, it is important that when early flu-like symptoms occur alongside recent travel to areas of concern or exposure to environments where rodent-human interaction is likely, the patient be evaluated for possible hantavirus infection.
Scott, how can people protect themselves from hantavirus? Is there a vaccine?
I don't know if there is, but we're going to talk about it, I guess. The best way to protect against Andes virus and other hantavirus is to limit exposure to rodents and to individuals exhibiting flu-like symptoms. There is currently no approved vaccine or specific treatment for New World hantavirus in the United States. Many research groups, including ours, are developing vaccine platforms that could serve as a basis for an Andes virus vaccine. Okay, so
I guess they just give you fluids, trying to ride out the symptoms, I guess. Black plague, man, Black Death. Vaccines for a limited number of old world hantaviruses, such as Hantavax, are available in some countries. However, these vaccines are not considered broadly effective against most hantaviruses, including those found in the Americas, such as Andes virus.
But you gave me the vaccine. You gave me the vaccine. How come I'm not getting better? Okay, for those infected, supportive care such as intubation and mechanical ventilation typically plays a central role in treatment. So that's kind of sounds like the treatment for corona, right? The coronavirus one.
Helping you breathe, yeah.
When you were past the point of no return.
All right, Scott, what lessons should the cruise industry and public health agencies learn from this outbreak to better prevent or respond to future zoonotic disease events?
Well, they better double check their rodent population and do some fumigating or something, or I don't know, get rid of those rodents. So
remember, I told you that there were hawsers on the lines, you know, to prevent rats from jumping over the line and crawling up.
Yeah,
metal aluminum hawsers to block.
Yeah. But they got to do better than that because obviously they're getting on there. So
I wonder if rat catcher is a full-time position on the ship, chief rat catcher.
I don't know, but hopefully they're not wearing more than one hat if they're doing that. So
I wonder how much that gets paid.
Chief cook and rat patrol.
Yeah, rat patrol. There you go. I wonder if you get free food and room and board. I'd do it.
I don't know. Yeah. Hopefully you're not touching any food when you're doing that. So.
All right, folks. Thanks for joining us. We hope you learned something.
See you this afternoon. Thanks.